Good morning, everyone. And today, in this lecture, we are going to talk about pediatric musculoskeletal problems. And just for introduction, there is a lot of musculoskeletal problems. Some of them which we should be worried about. Some of them which we should not be worried about. For example, like the common things like bow legs or knock knees. Bow legs are also called as genu varum, whereas knock knees are also called as genu valgum. Or there is flat feet, there is in toeing, there is out toeing. So all these things, they are present most of the time. But like, of course, in this lecture, I'm going to talk about uh, some common conditions, like not so common, but like some important conditions which uh, are related to pediatrics group. So again, like to talk or to go according to the symptoms. One of the thing, by which you can say the children may present is um, limb pain. Okay, limb pain in the limb. Now, why this thing is common? Of course, like limb pain could be due to multiple reasons, and in pediatrics, it's good to remember the causes uh, according to the age group. Now, some of the things, for example, trauma can give limb pain, infections can give limb pains, inflammatory conditions can give limb pains, tumors can give limb pains, and there are some pain syndromes like growing pains can give limb pain. So, just to give you an overview, limb pains can be classified according to the age group. So, for example, the first age group is less than 3 years of age. Okay, then there is an age group which is three to uh, 10 years of age. Okay, and then there is an age group which is more than uh, 10 years of age. Okay, so now um, the important thing over here is what why I am dividing them into these age groups, because there are different causes. Some of them they are common. Okay, so what I will be doing, by the way, I'm going to write about first of all uh, the problems which can occur in this age group, and then like for example and then why I'm going to make one group, you can say, over here. Um, Wait. I'm going to make one more group over here. Um, you can say um, causes of limb pain which can present in any age group. Okay. So why I'm including this thing here? Like, of course, uh, you would understand like in this way. For example, trauma. Now, trauma can occur in any age group, and it can give limb pain in any age group. For example, infections like osteomyelitis, right? For example, septic arthritis, okay, or other conditions which can present in any age group, like you can say sickle cell disease. For now, sickle cell disease can give the pain, not just limb pains, like any kind of features in any age group. So that's why I'm including this one, right? Or like cancers and things like this. Okay, so these are like the common things, right, which can present in any age group. Um, Tumors, I'm not including in this one because they are very uncommon in less than 3 years of age group. Rather, they are more common in other age group. Now, whenever there is limb pain in less than 3 years of age, so other than these common causes which are present in all the age groups, there is a condition called as transient teno transient. Wait, there is some spelling mistake over here. Transient tenosynovitis. It is also called as irritable hip. Okay. Okay. This is one of the cause, right? Then there is something called as uh, developmental dysplasia of hip joint. Okay, now this one is basically typically doesn't give limp pain, but it is a diagnosis which is done most of the time nowadays right after birth, right? I'm going to talk about that as well. Okay. Then there is a cause called as juvenile idiopathic arthritis. Okay, which is present in this age group. Uh, okay, rest are all the common causes. But if if we will discuss in this 3 to 10 years of age group, so other than these common causes, you can say the causes which can occur in this age group more commonly. Okay, so this one, transient tenosynovitis or irritable hip, can present in this age group, irritable hip. Okay, now in this age group, for example, juvenile idiopathic arthritis can occur. Okay, other than this, by the way, we can remove this juvenile idiopathic arthritis from here and here, and just to make it easy, I can include in this one as JIA, juvenile idiopathic arthritis. So irritable hip can occur, right, in this age group. And one of the thing which is important over here, this is the age group when the limb pain can present, and the babies may have Hinox scolion purpura, HSP. Maybe in this lecture or maybe in the next lecture, I'm going to discuss about this one. But the most important condition which I want to put in this age group is called as basically it is called as leg calf Perthes disease. Okay, it is more commonly known as Perthes disease. Okay, Perthes disease, and bone tumors can occur in this age group. Okay, as well as one very important thing is growing pains. Okay, now what is growing pains? Like, just I want to discuss over here. Uh, Growing pains most of the time occur in 3 to 10 years of age group, and they are basically diagnosis of exclusion. So simply we look for all the other causes, and when we cannot found any causes, we say like the baby have growing pains. Like, these are basically non-articular pains. Non-articular means what? Like the one which doesn't affect the joints, rather they present in the bones, and when you examine them you will found no other abnormality, and they present with pain at the night times mostly. It is often bilateral, and they are sometimes limited to calf, shin, and thighs. Okay, so now why they are called as growing pains? Because this is the time when the child bones are growing, and they feel pain at night. They get disturbed, and most of the time, these childs are well. They are asymptomatic during the daytime, and they don't have any functional limitation. Like they play well, they run well, they like everything is normal. And how to treat? Like, most of the time, we just tell them like this pain. Sometimes if it is too much disturbing, we can prescribe them with mild analgesics, but massage and heat, most of the time it relieves such kind of pain. So growing pains is common in this age group, right? More than 10 years of age, other than these common causes which I already talk about, I want to talk about, like, okay, uh, now this irritable hip is not common in this one, right? So okay, but rather this age group get most of the rheumatological type of conditions like SLE, dermatomyositis, and all this stuff, right? Um, the important thing to talk about here is what, like, for example, there is something called as systemic arthritis, which is also called as Still's disease. Okay, like these are the children who come with fever spikes, okay, for more than 2 days per week, and the children, they become very unwell during the fever episodes, and they have some extra articular features as well, like a rash, lymphadenopathy, and things like this. Okay, so now uh, that thing can occur. They may have arthritis, which can be oligoarticular arthritis, like 1 to 4 joints are involved, or which can be more than 4 joints, like 5 or more joints are involved. We call it as polyarticular arthritis. Okay, or they may have psoriatic arthritis. Okay, so simply as they are not, like, they are less than 18 years of age, so we cannot say them like psoriatic arthritis or things like this. Rather, we just tell them, we label them as oligoarticular arthritis or polyarticular arthritis or psoriatic arthritis. But remember, like, they are more common in females, okay, than males. And later on in their life, they have increased chances of getting rheumatoid arthritis and adult rheumatological disease. So you can say rheumatological issues can be there, right? But named in a different way, you can say only, right? But in this age group, like, the disease which I will discuss with you guys is called as SCFE. It is slipped capital femoral epiphysis. Slipped capital femoral epiphysis. Okay, bone tumors can occur in this age group, as well as you can say again growing pains can be there, but not too common. So, like, let it be in that group. Okay, so what we will discuss is, we will discuss DDH, we will discuss irritable hip or transient tenosynovitis, we will discuss LEGG-CALVES-PERTHES disease, we will discuss CAFE, and maybe I will discuss HSP in this lecture if there is time, or I will discuss Hinox-Collin in purpura in the next lecture. Okay, so first of all is DDH, or developmental dysplasia of hip joint, of hip, of the hip, or of hip, right? Now, if you listen to my lecture, like how we examine a newborn child, I talk about 2 tests. One is called as Barlow's test, and one is called as Ortolani test, right? Barlow maneuver and Ortolani maneuver, right? So, or test. And I told you, like, you can use YouTube and you can see, like, these 2 tests. They are very easy to perform. Ortolani, okay. So they are easy to perform, and I told you, like, you can use YouTube, you can see, like, how they perform these maneuvers, right? And these maneuvers, we do it on the newborn just to diagnose if the child is having developmental dysplasia of the hip. Okay. Now, what is developmental dysplasia of hip, guys? It is simply, you can say, a group of disorders in which there can be, or it range from dysplasia to subluxation. Subluxation. Okay. To frank dislocation of the hip. And all this thing rises due to what? Because now, because the child is born just now, and if you know that the hip joint is a ball and socket joint, the femur head is present in the acetabulum. So what happened, because that acetabulum is not well developed, so that's why the femur head can dislocate, which is like this way, or it could be frank dislocation, like if the acetabulum is not developed at all or is very less developed, the hip joint is very unstable. Now, why this thing is important? Because, or why we do this Ortolani and Barlow maneuver right after birth? Because early diagnosis or early detection, you can say, is very important in this one. Why? Because if we detect that this too early, we can do some conservative treatment and we can get good results. But for example, if the diagnosis is done late, okay, so there is a lot of hip dysplasia is already there. So now, like, it get complex to treat, and you can say like then we have to go for surgeries most of the time. So that's why we do this Ortlani and Barlow maneuver right after the birth, and we check the hip joint. Either it can be dislocated easily or posteriorly out of the acetabulum, and it can be relocated back by doing Ortlani maneuver. So Barlow is to dislocate, Ortlani is to relocate, right? So this test is can be done after birth. This test could be done at 8 weeks of age. Okay. So this is now, if we are not going to catch this DDH at the time of birth, so the later on the child may have a limp while walking. Maybe he will walk with an abnormal gait or with a limp, right? So uh, for example, I will show you something, maybe if I can found on this bing.com, because I cannot um, use Google right now. So if you will see, DDH skin folds. Okay. Uh, okay. See, yes, we found this thing. Basically, this one is like the drawings. Okay. For example, in this one, they are showing that see this the buttock folds or the skin folds around the hip, they are not symmetrical. Or for example, you can see this photograph, see, they are not symmetrical. Or for example, you will see this one, they are not symmetrical. And see, the one of the limb is down and the other, why? Because the femur here is dislocated, right? So the point here, okay, this one is like the Ortlani and the Barlow test. They are doing Ortlani is to relocate, but like better to see it, what you can say, uh, like on YouTube. Okay, again a representation of this thing. Okay, so leave this thing and you can see that video and the things will be clear. Okay, now most of the cases they resolve spontaneously. Okay, but it can occur in, you can say, uh, in 1 to 3 per 1000 live births. Now what we can do, like, first of all, we can do this test, and if there is any suspect of DDH, we can go for imaging. So for example, you can do x-ray of the hip joint. Okay, one of the thing is this thing. And uh, whenever this DDH is suspected or diagnosed, we quickly send it to the specialist, and basically we can do x-ray of the hip joint, we can do ultrasonography, okay, of the hip of the baby. So this one is better, by the way, ultrasonography, right? Because by this way they can also check like how much dysplasia is there, or either there is subluxation or either there is dislocation. So now I will show you, for example, a very severe case of DDH, like here. See, like this is a very severe case of DDH, like in which you can see that almost there is no acetabulum. You can appreciate even the bones, they are not joined together properly, and even the femur heads, they are not well developed, right? So this is, like, you can say, a very 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 severe case of DDH, right? Now whenever the child they are diagnosed with DDH, and we diagnose it too early, basically what we can do, something called as Pavlik harness. Okay, this is Pavlik harness. So we put the child in this harness. So this is the conservative management. See, because this one hold the baby in this neutral position and give it the time for the acetabulum and all the structures to develop, to mature. Okay. So if you will not do this thing, of course, the femoral head can go into necrosis. Okay, and the child may have limping in the later life. And of course, like if this thing is cannot, what you can say, solve the issue, then what we can do is like uh, surgical. Sorry, not this one. Uh, Rather, I will show you the surgical management of this thing. Okay, like of course, like the surgically, what they do is like they correct it surgically. Okay, then simply like surgical management can be the only choice, right? So anyone who have DDH, you can say the key is to uh, diagnose it quickly, because this splinting or this Pavlik harness is the one which can treat this condition. And later on, for example, if we will miss it, so then of course like surgical managements are needed. Okay. Other than that, guys, um, other than this DDH, one of the thing I told you that is called as irritable hip, or transient tenosynovitis. Now transient means what? Like for a short lived or for some time, right? Transient, right? It is also called as irritable hip. Now this condition and leg calf perthes conditions are closely linked together, and why they are linked together I will try to explain you now. Now transient synovitis of the hip or irritable hip, the other name or the correct name is transient synovitis of the hip. Okay, now what happens, guys? Basically, this is a benign self-limiting condition. Okay, this is a benign and self-limiting condition. And what happens in babies is like most of them, you will find a history of upper respiratory tract infection or pharyngitis or um, otitis media, for example. Okay. So what happens, and this one is more common in males than females. Okay. What will happen that you will find that the baby will give you a history of a recent upper respiratory tract infection, right? And what will happen, like after this upper respiratory tract infection, mostly viral infection, right? The child, they present with hip pain or limp. Okay. And whenever like they try to walk, they try to bear weight, they feel pain. So basically they prefer to rest. They don't want to move, they refuse to bear weight sometime even on the joint, and they refuse to walk. Okay. Why? Because there is no rest, no pain at rest. Okay. And they have decreased range of motion as well. Like if you will try to move their limbs, so they have limited range of motion, especially internal rotation. Now the child, they are afebrile. Okay, they are afebrile. Afebrile means what? Like without fever. And even if they have fever, like it will be very low grade. And the pain typically occurs in hip. Now, guys, a very important clinical point here, which I will tell you. Many times the hip pain also is referred towards the knee joint, and that's why remember that sometimes the babies, they complain of pain in the knee, but actually the pathology is in the hip. So that's why one of the rule of orthopedics is what? Anyone who is complaining of any joint pain, you always have to examine one joint below and one joint above. So if someone is practically complaining of knee joint, always examining their hip and ankle joint. Okay. So they have a painful limp, or you can say like they will refuse to bear weight. And this is not a chronic condition, it's transient. So you can say around 1 week, or you can say 7 to 10 days. the condition is resolved. Okay. Now, if you are understanding this condition carefully, guys, the most interesting thing about this condition is what? See, there could be some causes of hip pain which can be bad for the patient. For example, it could be trauma, it could be osteomyelitis, it could be septic arthritis. But of course, here, like, there will be too much fever, the child looks sick, and all the stuff, right? But one of the things which can be there and which can, okay, this condition, if the baby have irritable hip, guys, it is going to, the child is going to recover from it without any complication, and he will be fine after 7 to 10 days. But one of the conditions which present in the same way and can cause serious consequences on the child is Perthes disease. So that's why we have to rule out all these causes, right? So of course, if the child is coming with almost no fever and just like painful limp and all this stuff, so you can rule out, for example, okay, you will ask on the history about trauma, okay, it's not there, the baby child is not toxic looking, there is no redness, and all the examination is normal. Okay, so you can rule out septic arthritis, you can rule out osteomyelitis, but still, two conditions which will be there, one is transient synovitis and one is Perthes disease. I told you one point, transient synovitis or irritable hip will go away after 7 to 10 days, but if the baby have leg calf Perthes disease, it could be bad for the patient. Okay, now here comes the main thing. For example, the important thing is what to differentiate. Transient synovitis, the fever is absent, septic arthritis, the fever will be there. In transient synovitis, the child look well, septic arthritis child or osteomyelitis child will look very much sick, right? Okay, now what we have to do, we will go for investigations. Why investigations? Because we have to rule out our differential diagnosis, right? So see, now investigation in this condition is important. Why? Because you have to rule out some of the causes which can cause damage to the patient. So for example, you will go for CBC. If the CBC is normal, okay, there is no infection. Okay, WBC are in normal limit. You can go for ESR and CRP also, right? So if they are normal, okay, now they could be normal or they could be mildly elevated, means there is, of course, like there is some sort of inflammation is going on. You can go for imaging. Now, imaging is very, very, very important because you have to rule out which condition. You have to rule out, guys, just one condition which can present in the same way but cause serious consequences to the babies, which is simply called as, like, the short name is Perthes disease, but the long name is LEGG-CALVES-PERTHES disease. Okay. So if the imaging is normal, it is transient tenosynovitis or some transient synovitis or irritable hip. But if the X-ray is abnormal, I will tell you what abnormality, then it is Perthes disease. Okay. So remember this thing, that we want all the investigations to be normal. Inconclusive, you can say. Why not normal? Because maybe ESR and CRP is mildly raised. So remember, transient synovitis is a diagnosis of exclusion. Okay, you got my point? It is a diagnosis of exclusion. If you found, guys, any abnormality, it is not transient synovitis. And you know how we treat a transient synovitis? Nothing. Just symptomatic treatment. Okay. If the pain is too much, you can give an anti-inflammatory drug. Otherwise, no need of any treatment, right? Because it's a self-repeating condition. Okay, now guys, I will tell you why I was stressing on the X-ray. I will show you one X-ray now. I'm showing you this X-ray. I can show you this x-ray. Okay, and why I'm showing you this x-ray, very important thing is what? This is the x-ray of LEGG-CALVES-PERTHES disease. Basically, what is Perthes disease? This is avascular necrosis of the femoral head or the capital femoral epiphysis. Okay. Remember, guys, the blood supply of the head of the femur, if you have done anatomy in a good detail, you would know like it is coming from here. There is a ligament by which the femur is attached with the acetabulum. In that ligament, there is an artery which is running over here. So it gets its blood supply from there. Why that? Now, whenever there is any problem, it can lead to necrosis. So LEGG-CALVES-PERTHES disease or Perthes disease is avascular necrosis. Avascular means there is no blood supply. Necrosis is there. You can see here and here, or you can see here how it looks like and how this one looks like, right? It is avascular necrosis of the capital femoral epiphysis of the femoral head due to interruption of the blood supply, followed by revascularization and reossification over 18 to 36 months, or you can say from 1.5 years to 3 years. Now, guys, remember, irritable hip, LEGG-CALVES-PERTHES disease is more common in boys. Which age group is the one which get this one? 3 to 10 years of age. It presents in the same way with limping or hip pain or knee pain. I told you hip pains are referred to the knee pain. And we can miss this condition if we will not go for x-rays. We can miss this condition. For example, if you will say, okay, it is transient synovitis. Transient synovitis or irritable hip, right? So now it could be unilateral. Sometimes it could be bilateral. Okay. So remember, whenever you are labeling anyone with this condition, always go for an x-ray. Always check for the femoral head. Okay. If you will found the femoral head is irregular or fragmented, okay, think about this condition. Sometime maybe you are doing a too early x-ray and the changes are not there, so always go for a repeat x-ray or a MRI or a CT scan. Okay, because again, like DDH, the prognosis of this condition also depends on early diagnosis. Okay, why? If the femoral head is affected, guys, remember, the child will be having, or that person will be having limp for the rest of his life, or sometimes even maybe you have to replace the femoral head, right? So what they do, by the way, at junior level, we don't deal with this condition. Any patient who have this condition, we quickly refer them to what? To orthopedic specialist. We refer them, they tell them to do bed rest. Sometimes they ask them to, they put some traction also, okay, to treat that. And simply they keep on checking them time by time to see like the changes in epiphysis, if it is reossifying or not. Okay, or sometimes they put a plaster. Okay, why? Because if it is damaged, then of course surgical options is always there. Okay, though the prognosis is good, it's not so bad, but remember that children who have like permanent deformity of the femoral head, they have degenerative arthritis in their later life. You know, the specialist, when they devise them any exercises, they tell them do non-weight bearing exercises like swimming. You know, in swimming, like if you will run, of course you are doing a weight bearing exercise. So swimming is better exercise, best exercise. They can do cycling and stuff like this. So this is LEGG-CALVES-PERTHES disease, and that's the connection of this disease with irritable hip. The last condition which I'm going to discuss in this regard is called as SCFE. SCFE, or what is SCFE? It is basically slipped capital femoral epiphysis. Okay. Now, guys, again, I will just tell you the differences. Very easy to remember. Very easy to remember. Okay. First of all, I will tell you X-ray. Remember, all these conditions are more common in guys. This is the first important thing to remember, right? Okay. Now see this X-ray. This X-ray is an X-ray of SCFE. If you will compare this side with this side, what you have seen, see, it is normal, and this one is slipped. Okay, this is the head, so this epiphysis is slipped. Okay, wait. Slipped capital femoral epiphysis. Look, this is basically what's going on. Okay, this is the stable SCFE, this is the unstable SCFE, and what X-ray I'm showing you is the unstable one, because this one is completely displaced, right? It is a displacement of SCFE, right? Understand? Very easy. You can say the concept is easy, right? Okay, so okay, now guys, see, what is the age group? More than 10 years of age, number one. Number second, do you think that this slip will occur in a heavy, in a overweight, or in a fat boy, or this slip will occur in a very lean person? Of course, when there is too much weight from up, there will be pressure on this one, and this one can be slipped. So remember, you will find any boy with SCFE, he is usually very fat. Okay, so simply there is displacement of the epiphysis of the femoral head posterior inferiorly. Okay, and again, it's an emergency. Refer them to the doctor, to the orthopedic specialist, because prompt treatment, prompt diagnosis is very important, because again there could be avascular necrosis, right? It is most common above 10 years of age. They are obese boys, and it could be bilateral even. Okay, so now remember these things, and simply they also present with hip pain or knee pain. Okay, they have difference in their leg length. Why? Because of the slip, one of the leg is shorter. Okay, so the onset is acute, and on examination, when we examine them, there is decreased range of motion, there is restricted abduction and internal rotation of the hip, and simply diagnosis can be done on X-ray. You can see over here, or you can see over okay, you can see over here. Okay, now if I will, okay, I show you this thing. Wait, I will include one more X-ray just to finish my discussion. See, a patient who gets SCFE, look, this one and this one, and this is after fixation. Remember guys, surgery is the only option. They put a pin to fix it. You can see over here and here, right, to prevent avascular necrosis of the femoral head, right? So this is about SCFE. Okay, and the last lecture will be about Hinox colon purpura, as well as with, well, okay, we can discuss two conditions in that one, Kawasaki disease and Hinox colon purpura, and that will be the end of your what you can say, um, pediatrics, right? So thank you so much guys for listening.